Okay, so this short segment is going to be on concussions, and I'm not sure if I'm going to articulate this well, but it's going to be how you can have concussion type problems and symptoms without having concussions. And Dr. Gates is going to cite some new data that is very recent that we think is very interesting. I am Dr. Martin Rutherford. I am a certified functional medicine practitioner. I also am a chiropractor since 1980s. This is Dr. Randall Gates.
I'm a board-certified chiropractic neurologist as well as being a chiropractor.
And the profession of board-certified functional neurologists are very conversant in a lot of fields relative, or a lot of different aspects of conditions relative to the brain. But concussion happens to be, I think, one of the most studied and most prominent in their armamentarium, and we do work with concussions that is, I would say, vastly different from what is out there. We have a practice here in Reno, Nevada, in which we treat a lot of chronic conditions, a lot of chronic illness, a lot of chronic pain, and concussions are getting the highlight now. They're getting highlighted. The President's Symposium, the NFL, our concussion issue. And so we're going to try to keep the public up on the latest and they're in that field. And there's some actually there's data on this from years ago relative to car accidents. I used to do a lot of work in the personal injury field when I was doing primarily chiropractic work, and there was a lot of data on how you could not hit your head on the windshield, right, on the backseat, and still the patient would be sitting in my office going, yeah, I just feel, this is like 2 weeks later, I just feel dingy, and I walk into rooms, I can't remember why I'm there. And sometimes I forget my husband's name now, and I'm at the stoplight, and I forget where I'm going, but I'm okay. So, by the way, that's a concussion. So Dr. Gates has some really cool new stuff to share with you, and this is an exciting field for me because I'm 62 years old. I came from an era when you played sports, you got your bell rung, and you definitely said you were going to go back in there, you were going to and I did that many times, so I came away with many concussions, as Dr. Gates found out when we got together and did the neurological exam on me. So I'm very interested in this. The types of things that we have done have helped me tremendously, and I'd like to have the data that can help you too.
Absolutely. So we'll go into it. And before that, I just want to clarify. So what we do is term functional neurology. What you do is term functional medicine.
What I say?
We term you a board-certified functional neurologist, technically board certified.
I say that every time. We've been doing this since January. I think I would get one. But you know what? I have had a lot of concussions.
So we have an explanation for that.
We do. But I used to not remember a lot more than that. So
I want to start explaining some of these NFL athletes' behavior because of the concussion.
Oh, you think?
I think you can make an argument for it. It's pretty strong. Okay. But we'll see if that happens. But anyways, yeah. So this landmark article out of Brain Connectivity published literally yesterday, maybe the day before, September 22nd. So today's the 24th. And it came out and said they took these high school athletes who were football players who hadn't had a concussion. And they looked at the way their brain was performing before the season by imaging their brain. All of you concussion sufferers out there want the imaging studies. Okay. So they do this thing called a functional MRI, which basically shows how active the brain is. And then they look at guys who are not football players of the same age, and they see that the way the brains are processing of football players is completely different from those who are not playing football. So immediately they say, whoa, there's a difference here. And possibly these repetitive head injuries that they've had in seasons past playing football may have something to do with this. Then they track them as they go through the season and see that their brain starts functioning even more differently from these repetitive head injuries when they haven't had a concussion. So now we're looking at this and they're saying they're subconcussive hits. So they're not knocked out, they're not blacked out, they're not over on the sideline falling over, but all of these repetitive head injuries are hard on the brain, changing the way the brain is functioning, changing the way the brain is activating. That's really what we want to talk about today. I have 4 other articles. If you want them, email us, contact us at powerhealthtalk.com, send us a message on the Facebook page. I actually wrote an article on our Facebook page. We wrote an article on our Facebook page yesterday about this. And because it's a really, really important issue, and we're talking about football. The more we're learning about football, the scarier it's becoming.
I'm kind of a
frankly.
semi-football fan. I mean, I don't like to sit through a whole game, but I do like to watch the highlights at the end of the day and see who's winning and so on and so forth. We're here in Reno, so everybody here is like San Francisco fans or Oakland Raider fans, mostly San Francisco fans, I think. And the game's going to change. I think football's not going to look anything like. Forget the politics. I think football's not going to look anything like it looks right now. Maybe as soon as 5 years from now, but
yeah, probably not.
Either that or we're going to have them starting releases. Like, I know that by the time I'm done with 10 years of this, my brain is going to be totally not functioning, and I'm going to have headaches, and I'm not going to be able to remember anything. And I'm going to die a long, slow, miserable death because my brain is deteriorating rapidly. Maybe that'll happen, but I don't think so. I think it's going to be more like you're going to see game changes. But you do not, point being, and again, I go back to years ago when I was doing research and trying to represent people's injuries properly in court. I go back to years ago in which I'd have patients come in and they would get their bell rung, but their head didn't go through a windshield. They got an accident, didn't go through a windshield, but they had every neurological sign of having an MRI, of having a concussion. And the MRI, and they would do MRIs, and the MRIs would be normal.
And the MRIs are often normal.
And the MRIs are often normal, and so now you had the other side going, well, these people don't have a concussion. Meanwhile, the person's walking around, they can't remember anything, they're getting headaches, they're lightheaded, they're dizzy, they're all that type of stuff. And there was research out then. They call them mild traumatic brain injuries. That's what they're still calling them. So look, you can look up mild traumatic brain injuries, and how could you not have that in football? How could the lineman not have that in football on virtually every play? So it's a pretty cool topic. If you want to know anything about concussions, I would say, tune in to here. You feel free, if you've had concussions, feel free to contact him because Dr. Gates, I think, is very well versed in concussions based on the results that we get here, and we'll do our best to answer. But hopefully, this is like kind of a cool little thing for you to know.
Yeah, and we try to present the updated literature because basically, as we've discussed in other broadcasts, as you saw in the personal injury world, the neurological community poo-pooed these subconcussive headaches,
completely.
And even the post-concussion.
I got ripped apart on stands by neurologists.
Right, and then now
that's a bunch of crap.
They've completely changed the song and dance. Nothing against neurologists, but basically we've seen the neurological community shift in their opinion about concussions, largely due to the NFL's awareness, in my opinion, about this whole issue. And so we're trying to present the data because a lot of you out there with concussions say, well, what's the treatment out there? And really, lots of times, there is no accepted scientific treatment for a concussion at this point. We're only beginning to learn.
But there is treatment for it.
Yes, but we're only beginning to learn from the scientific neuroscience community what is actually happening with a concussion. And so you can access our other broadcasts on concussion. We've talked about it from PowerHealthTalk.com. You can YouTube us and type in concussion, Dr. Randall Gates, Dr. Martin Rutherford, and stuff will come up. So that's all we have to say.
Yep.
Thank you for watching, and we'll talk to you soon.